An inquiry into the deaths of hundreds of people at Stafford Hospital is expected to recommend sweeping changes to the National Health Service.
According to the Sunday Telegraph, the investigation will call for poor managers to be replaced and better training for nurses and healthcare assistants.
It was one of the biggest scandals in the history of the National Health Service. Over a 4-year period from 2005, up to 1,200 people died needlessly at Stafford Hospital, the victims of neglect or substandard care. Cases included patients dying after falling when they were left unattended. Others were denied food and drink. Some were so dehydrated they drank the water from flower vases. According to the Sunday Telegraph, the results of the public inquiry will deliver a damning verdict on the entire NHS. It says the chairman, Robert Francis QC, will describe a culture of fear in which pressure is piled on staff to put the demands of managers before the needs of patients. The newspaper claims the report will call for greater regulation of NHS management and an overhaul of training for nurses and also health assistants. One of those who died at Stafford Hospital was Bella Bailey. She was admitted for a routine hernia operation in 2007, but was dropped by a nurse and never recovered. Her daughter has set up a campaign group, and on Friday she spoke to Breakfast.
We should have a safe system within our hospitals. There shouldn't be an acceptance of any harm. There should be no harm, zero harm. We should have a safety and quality system implemented decades ago to other sectors like the airline industry and the construction industry, sadly lacking in the NHS.
The public inquiry's report is expected any day now. A spokesman for the Department of Health said any comments on its findings were pure speculation. John Brain, BBC News.
Bushfires on